So what are we going to cover in this session? So basically we're talking about hospital initial assessments that are completed by occupational therapists. So first of all, we'll talk about what actually is it. So in short, it's just an interview-based assessment that generally we'll complete with patients within a hospital setting. So they're inpatients. This is the format that we're focusing on, is like that inpatient admitted to hospital. And the example we'll use will be focusing on adults. And what you'll find in this sort of assessment is that the primary aim of what we're trying to achieve with all the information we're gathering is to determine what are the recommendations for discharge. How can we get this person out of hospital and safely home? What you'll find is that some hospitals will actually have their own initial assessment form that will tell you questions that they would normally ask, but you might think about, okay, do I need to ask all these questions? Is there some questions that need more detail for certain clients or patients, or some that I can leave out for certain patients? So we'll talk through a little bit of those logistics in terms of what you might want to cover, because generally we'll be covering things like diagnosis or the other comorbid medical history, their social history, home environment, their previous and their current function, their goals and their concerns for discharge, and then what our future OT plans might be. But we may not ask these sorts of questions in exactly the same way or with the same level of detail. So we'll talk through how we decide those things. And sometimes we can also gather information from a file, so we don't need to ask them the same question. So that was one of the examples why we may be able to leave out some information. And sometimes it's because their baseline function is very different. So maybe someone that was already quite reliant on help or assistive technology or equipment compared to maybe a young adult that's just broken a leg, it's going to be a different level of detail that we're going to be asking because that baseline function is so very different. So we'll run through all that background, but then the bulk of the session will actually be me giving you a demo of an initial assessment, and it's going to be an older person in hospital after a hip replacement, so on an acute ward. And then what you can do as you're watching, I'll give you some questions to think about to analyse what parts you think were done well, which parts could be improved, if there's things that you've seen other supervisors do differently. And then to finish up, we'll give you some strategies to build your confidence and competence with initial assessments. So you might be able to use some prompt sheets or practice some role plays or reflect on your own performance, so you can be really targeted in the practice. If you're finding these initial assessments tricky as a student, we'll give you some ideas for how you can maybe improve going forward. And then as usual, there'll be a little wrap up with some homework options for the keen beans that want to do a little bit more, but there's lots to get through. So we're going to jump straight in now.